My name is Madison. This is going to be my saline lock removal video. I'm a student nurse with the University of South Alabama, and I would have included this in my last video, but if you saw in the video, the gauze pad actually flew out in the middle of that, and I didn't have a second pair of clean gloves. So I had to take a pair of my sterile gloves out of the packaging. Okay, so we would walk back into our patient's room, we would reintroduce ourselves, then we would recheck our patient, Jaguar Jones, date of birth, 8/25/63, 8/25/63, double check his allergies again, penicillin. We would also double check that he had the orders to get that saline lock removed. So then we would perform hand hygiene. We would bring the patient to working height, lower the bed rails, make sure they're comfortable and in the correct position. Once again, they can either be sitting up or laying down. So then we would assess the IV site for any signs of infection, secretion, swelling, redness, anything like that. Then, so we've already performed our hand hygiene, patient's positioned, we would don our goggles and our clean gloves. Okay, so then we would pull up that tape. Right, and then we would stabilize it and remove the tegaderm, going from the outside in towards the insertion site. How it likes my gloves. Okay, then we would dispose of the tegaderm. Okay, well, we would dispose of the tegaderm, and then we would get a gauze pad, fold it, and apply pressure right above where your catheter will be removed. Then you pull the catheter out, leaving it parallel, and you dispose of it into your sharps container. And then you would get your tape. I pre-pulled mine, and you would place that tape down, and you would apply pressure on the gauze for up to 30 seconds. But that will conclude, then we would make sure the patient was comfortable. We would lower the bed back again, raise the bed rails, and then we would document if there was any, we would perform hand hygiene, and then we would document if there was any secretions or redness or swelling at the insertion site, how the patient handled the procedure, what time you removed it, who removed it, and after the patient was back in lowered position, comfortable, had everything they needed, that would be the conclusion of my removal.